We're starting today with a conversation about facial balancing. And if you're interested in anti-aging, this is a segment you won't want to miss. We've got Arlette Cross joining us now, and she's the practice owner of the Face Bar Aesthetic Medicine in Pasadena, Maryland. Hi, Arlette. How are you?
Good. How are you?
Thanks for coming on the
Sandy?
show.
How's everything going?
Great. Thank you for being on the show. This is so nice.
I'm honored to be on here. Thank you.
Thank you. So facial balancing has become such a buzzword in aesthetics. Can you explain to our viewers what facial balancing actually means and why it matters?
So yes, it has become such a buzzword, but it actually is really important. Facial balancing officially is enhancing or restoring the harmony among the different features of your face. It's not just focusing on one area. You know, patients used to come in, they used to say, I just want nasolabial folds, I just want lips. And, you know, after, doing this for a long time, we realized that if you just do one area instead of the whole face, it can look unnatural, it can throw everything off. We really focus on the upper, middle, and lower thirds of the face. And then the harmony between like the chin, the lips, the cheeks. So no more of that just coming in to get your lips done or your nasolabial folds. You have to kind of do a global facial assessment. And yeah, so it's definitely important. It's the way we inject now, the way everyone should be injecting.
Yes, so that makes so much sense for our viewers. So for people who aren't experienced or going to an injector for the first time, would you recommend they need to find an injector that understands the entire aesthetic of the face to make sure that everything is balanced?
Exactly. And when you're first assessing the face, you definitely need to pay attention to the overall shape and symmetry of the face. You need to look at the mid-face projection, the chin-lip ratio, jawline, contour, before you just, start throwing filler in there.
Right, exactly.
So you really need someone who's an injector that is safe, obviously, and really understands the artistry of just looking at the face.
So basically, you're an artist. You're not just an injector, because you pretty much have to be.
I feel like you have to be. I really do.
I think it's so important for viewers who have never had any sort of injectable before. What should they expect when they walk into the office for the first time? Like, say I've never had Botox before, I've never had filler, this is my first time and I'm nervous. Walk me through a day, the first day of getting this done.
Sure. So when patients come in, they do have to fill out, and I know we're not a medical, I mean, we are medical, but a lot of people ask us, why do I have to fill out so many forms? Why? Because it's important to know your medications. It's important to know your medical history. There's things that could potentially make you not a good candidate for Botox or fillers or other things that we offer. So they do fill out several forms and consents, obviously giving us permission to do that. And then after they fill out their forms, they meet with, here in Maryland, a mid-level or a doctor. And they just, we determine if they're a good candidate for the treatment, kind of check off. RNs can inject here in Maryland as well, but they need an NP or a doctor to kind of make a plan and clear them for having the procedure done. So after that's done, I explain all the consents, make sure that they understand, they're very informed, and then we come up with a plan, right? It should be customized. It's not just one thing. It's not just tox, but we call it tox, but because we don't want to say Botox, because it's Dysport, Jeuveau, ZMN, Daxxify, but we say tox now. That's the other word that we use now. And basically, we make a plan that fits, their needs. Also, you have to take in consideration people's budgets, timeline, events. And then sometimes the first appointment is just a consultation, just to kind of talk about what we're going to do. Other times the patients are ready to go. And then we just, when I don't know a patient, I always kind of like to tiptoe in just to make sure that we fit personalities, because that is important too. You have to kind of have the right vibe with your patient.
Yes, that makes
So-
perfect sense.
Absolutely.
So
Yeah.
when you're looking at the face, the key features that you're focused on would be like the jaw, the nose, the upper,
Mid face,
the mid face.
like I said, yep, chin to lip ratio, jaw, the nose. Yeah, we got that. Yep, chin, cheeks, jaw, and nose. I would say that would
So are
be-
you measuring, or can you just tell by looking, or do you use like an instrument to measure?
So I do have an instrument. Do I use it very often? No, I think I can look.
Yeah.
I think I've been doing this a little while, so I can look.
So you're
and-
so experienced that you can just look at somebody's face and automatically say, oh, I can change this, I can do this, I can add this.
Yes, I feel like I am confident enough to look at that. And sometimes you do one thing and you're like, okay, now I think I can make this a little better. But it's never about changing someone's face. It's really just enhancing and respecting someone's natural anatomy.
Right.
too.
Yeah. Is there any sort of aftercare when you get procedures like this done? Like, what do you do? So you get the injectables, but what do you do when you leave the office?
So when you leave the office, you leave with a little card in my office, one that
Yes.
has my after hour number, because
Okay.
That's
you're new
great.
to me. Let's
Yeah.
say, let's talk about filler, right? Filler, there's always a potential. Obviously, it's safe, but there is things that can happen. So my goal is to always have a lifeline. So they leave with a card with my number that they can call me after hours. So the things that I tell them is obviously keep the area nice and clean for 24 hours. Don't exercise for 24 hours. This is filler.
This is huge. So many people I know go work out after the injectables because they think it's not a big deal. And I'm like, what are you doing at the gym? Like, you can't be going upside down 12 hours after you got filler.
Yeah, there's little holes there. The
Yeah.
sweat, you don't want to cause an infection.
All of it. Yeah.
You know, they tell you not to lay flat after 4 hours. Don't lay flat for 4 hours after tox.
Oh, interesting.
Yeah. So, that's controversial too. Some injectors say, it's okay. But personally, I follow what we've always known to do is don't lay flat for 4 hours.
Right. So you're an expert. So
We
we're gonna
listen to
we're
the
gonna listen
expert.
to you.
I mean, here's the thing: why not be safe, right? Like, if you get tox, why not wait that 4 hours and err on the side of precaution? Because at the end of the day, it is a medical treatment,
It
and I
is.
think people forget that.
It is. And to just kind of add to that, people do need to remember that is a medical treatment, because you need to make sure you check credentials for the injector. What safety protocols do they have at their office? Do they have the dissolver for the filler? Do they have a protocol for if they have an allergic reaction? I mean, I had a patient here that had a massive allergic reaction to B12. Totally unexpected. But since I've been an ER nurse, I did ER nursing before this for 20 years. We have all the things we need here. We have an AED, we had an IV, we had epinephrine, and we were able to really manage. Obviously, we had to call the ambulance the first time and only that we ever had to do that, and we were ready. So you want to make
And
sure.
you did it. And that's the thing.
Well,
the
'cause she's
fact
the
that you did
emergency
it
room.
because you're a nurse and you have that medical background, that's huge.
Which fillers or which injectables do you like the most for the face? Or do you do a combination of like Voluma and Radiesse? Do you combine for different parts of the face?
I do combine different fillers because there is needs for different things, right? Let's talk. I love Galderma products. I am a trainer for Galderma, but that is not why I love them. I became a trainer because I love the products. Also, RHA has a great product. It's called Redensity, and I call it the magic eraser. It literally wipes. You can inject it really superficially, so it kind of wipes away the little superficial lines that you certainly may not want to put the thicker filler in there too superficially, so it looks bumpy. And yeah, I would say those are my favorite ones so far.
What's your favorite for the lips?
For the lips, so everyone knows that I'm a big Kiss person, Wrestling Kiss. I love it. I use it about 90% of the time. If they have soft tissue in the lips, then I have to use something else, which is called Wrestle and Refine or Redensity. But yeah, I'm a wrestling kiss girl.
Yeah.
Yeah, I
like
love it.
wrestling.
So say you have an event coming up and you like your wedding and you haven't done injectables. What's the right timeline for getting started?
So to do it correctly and to do it the right way,
Yes,
you know,
the right way. We do
a year-
everything the right way.
If
Yeah.
you've never
We wanna do
done
it the
any
right way.
injectables, you're
Yeah.
getting to know your injector. I would say a year. I know that's a little
Oh, wow, a
dramatic.
year.
No, that's good though.
But if you've never, now I have
better safe
patients
than
who can
sorry.
come into
That's
me the
great.
whole, you know, and then they're like, okay,
Yeah.
I'm getting married. I always say, please, 6 weeks. If I know you, if I don't know you, I will not inject someone who's new to me and who like, oh, I have a wedding in a month and I've never done any injectables. I often say, I'm so sorry. Go with what you have now. Come back after. I know you want to look great for your wedding day, but if you change something right now and you don't like that a month from now in your pictures, you're not going to be happy. So really a year is where you should really start. If I know you and you've been coming to me and then you get married, I would say, let's not do anything past 6 weeks. We need time
Wow.
for settling, for bruising. And we all know that tox looks best usually at 6 weeks.
Right.
It has time to settle.
And then do you also like the PDO threads? Do you use those for facial balancing as well?
I do. That's needed. You know, when someone
Yeah.
comes to us and says, I want this,
Right.
filler's not really doing that. The two things that usually help with that is a facelift,
Right.
which obviously I'm not a surgeon, or the PDO
Yeah.
threads. And, you know,
So
they're
I've done
temporary.
both.
Yeah, they're temporary and they build
Yeah.
collagen over time.
They do.
So they're a great substitute or a great holding you off until you can get some surgery.
Yes. I agree. So for our viewers, what can we say? Like, what's the best piece of advice that you can give in terms of their first time
Yeah. So I would
going
say
to
don't,
an injector?
if you're able to, because I know everyone's different and everyone has a budget, but don't bargain shop. Find your injector, find your
Right,
person,
right.
just like you find with your hair. Find your
Yes.
person, stick with them. You know, obviously you have to build trust. And then after a while, your injector kind of gets to know who you are, you know, what you like. It's a personality too. You know, I have people who are like very natural, very tiny lips. And then I have people who are larger than life. I want huge lips.
Yeah.
You know,
Yes.
and that comes with just getting to know each other. So
Yes.
definitely the safety part for sure. Finding the right injector, and then just building a relationship with them. And don't try to like hop around, because then one injector may say yes. And I have a lot of people that come back and I need to like dissolve and fix. And, you know, dissolving is possible, but it's not ideal, you know?
Yeah, that's definitely not. No, this
Absolutely.
is great advice and this is a great show. Thank you so much. And how can our viewers reach you or find you?
Yep. So I am Injector Doll on Instagram. I co-own the Face Bar Aesthetic Medicine in Pasadena, Maryland. And yeah, you can find me on Instagram, and then just look me up, and then please set up an appointment with me.
This is great.
I've been a trainer with Galderma for 3 years. I have about 27 years. I'm aging myself,
Wow.
but 27 years in the industry of healthcare. And I will always lead you into, you know, I'm not going to try to just take your money. I'm definitely
Yes, I
going
can
to
see that.
tell you to hold off,
Yes.
and don't do that, or, you know, do more, do less. So
It's great. We appreciate your honesty. This has been very informative and great. Thank you so much.
Yeah. Well, thank you for having
to
me.
finally meet you. Thank you.
All right.
Have a
thank
great
you.
day. If our conversation made you think, then why not share this episode with your friends and subscribe to help our community grow? We'll be right back.